That's a good question. Acute pain is a physiologic response to tissue injury. Chronic pain is entirely different, whereas acute pain is the symptom of a problem, pain from fracture or after surgery, something like that. But why in some patients does it become chronic? We don't quite know that. We think there's probably a large genetic susceptibility, but we know that in up to 20% of patients who undergo surgery, regardless of where it is, spine, joint, abdomen, they will have persistent post-surgical pain that needs to be managed as opposed to treated as we try to do with acute pain conditions. There are a lot of different options, and anytime there are a lot of different options for a condition, it's because none is perfect for everybody. Physical therapy is probably the most pervasive. Just about after every surgery, before surgery, physical therapy is recommended. Most insurance companies recommend it amongst their treatment algorithm for various conditions. And that's for good reason. Physical therapy can be very, very effective at helping to restore function after some functionally limiting event or injury or illness. There are loads of medications. Of course, everything has side effects, so we try to use those judiciously. There are things like injections that I do a lot of because I feel it's a great way to help people restore function without the risk of chronic daily side effects from medications. Some patients, they continue injections every 4 to 6 months for decades, and they continue to respond well, and the risks are worth it. Some find that while 1 or 2 injections are incredibly beneficial, they become less effective over time. Whenever that threshold is crossed where the risks outweigh the benefits, we recommend moving on to more advanced treatment options. So I do a number of advanced treatment options, everything from very specific symptom management sorts of procedures to more generalized symptom management procedures. Some require a very specific diagnosis or a series of diagnoses. Others are better for the general pain population. Some we don't even quite understand how they work. We just know that in certain patients, they tend to respond well to it. So something like an intrathecal pain pump, which we don't do a lot of, but we do some, is excellent for patients with cancer-related pain. It's excellent for patients who have multiple fractures but aren't good candidates for advanced surgery, all the way down to something like neuromodulation. That's a large umbrella that can be applying energy to peripheral nerves. It can be applying energy to the spinal cord, to nerves in between, such as the dorsal ganglion, where they are a bit more specific in what they target. Generally, specific is better. If you can find a specific treatment that's right for the patient, that's usually what we try to do. Usually you find your more favorable risk-benefit profiles with that approach. And when you can't, something more general like an intrathecal pain pump could be considered. That's a very frustrating place to be, and unfortunately I get a lot of people who are in that position where maybe I'm the 3rd or 4th or 5th interventional management specialist that they've seen. I will say that I am as well trained as anyone in the country. I have a laundry list of advanced treatment options that we can provide after more typical conservative management has failed. But it really starts with the diagnosis. Myself and my team are really experts at nailing down the diagnosis. And if it can't be easily discerned based on physical exam and imaging, we can recommend diagnostic procedures that help us to tease out the nuance of one condition versus another. It's all about providing the right treatment for the right patient at the right time, and having the ability to effectively and safely apply this large number of treatments is one step, but being able to identify the patient that needs that treatment is really where the magic happens. I'm Dr. Jonathan Silverman. I'm an interventional pain specialist at Orthopedic Associates of Southwest Ohio. You can find me on oadoctors.com.